Arkansas is all about family. It's all about community and relationships. And as a family physician, as a husband and father, Arkansas, and specifically Central Arkansas, is extremely beneficial to my personal life, my relationship with my wife, my family, and we really feel like we belong to the community. This just feels like home.
Little Rock has everything you need from a big city, but it's small enough that there's no big traffic problem. You can get anywhere you need to in about 20 minutes.
Several times. My husband and I both did our residency and then our fellowship here. We had our children here during residency and fellowship, and my third one was actually born the first year I started working at St. Vincent. But every time we went out of Arkansas, out of Little Rock, to interview and look at other places, we came right back and thanked God that we lived here. And we never thought we would do that, but that's how we feel. This is a wonderful hidden secret, a city which is big enough to be a city, but small enough that you get so used to the comforts.
The lakes during the summer, and the track and all the downtown stuff during spring and winter time, and really just a family-friendly place here.
I really do love Arkansas. We have lots of outdoorsy things to do. Here specifically in Hot Springs, we have Garden Gardens, we have tons of hiking trails, we have the lakes, the rivers. If you like to do outdoorsy kind of stuff, it's very good for that.
You have tremendous options to have a beautiful home in an affordable price. There are good schools for children. It's just a very nice community, so we couldn't find that anywhere.
We chose to stay here in Arkansas mainly for family, so that we were closer to our family. We have a son, and so that helps out with our work schedules and helping out with childcare. But we also love the state, and we love that there is so much to do here.
CHI St. Vincent, specifically the medical group, is very interested in integrating physicians, aligning physicians with our culture, which is progressing towards this next era of healthcare. We believe that this requires a team effort. It requires a partnership between administration and an integrated team of physicians and doctors, and the support personnel that they will use to administer care to our population.
For me, what's more important is the people that you work with, and I have found the people that I work with here to be like a family. When I was first interviewed, I was told that I was a young mom with 2 little kids, and I was very anxious about coming on board and what the expectations would be from me. And I was told that there's a big emphasis on family values and taking me on, and I have felt like I've been part of a family, the St. Vincent family.
So CHI has been pretty easy to work with. They're very supportive of their physicians, make sure that we're up to date on all the current things going on in the news. So the clinic here is very individualized. Each physician has their own preference on how many patients they see, what type of patients they see, what their hours are, what days of the week.
A lot of physicians get this concept and have experienced the frustration of doing the best they can in their own shop, in their own practice, and then lose their patients to an ED, an urgent care, a hospitalist who follows them during their admission, and then they receive their patient back in something less than a coordinated way, not necessarily better or worse, but just not in a coordinated effort. And I think that's frustrated physicians for a long time now, as we've become much more segregated in our practices. Practicing as a coordinated group has an appeal, has an allure to physicians. And so having a similar EMR platform to be able to share data, to have a partner that you know is going to take care of your patients in a way that you would if your situations were reversed, that has a lot of value to our physicians.
I really like that it's a team effort. I had an emergency case that I needed to do as somewhat of a surprise. We had planned to do her the next day, but we did a study which showed it needed to be done urgently. So I called the operating room, and we were in there operating within an hour, and it was really beneficial for that patient. It's necessary. When you find out you have someone you need to operate on, you got to have a team behind you to back you up, because I can't do the operation alone.
I have the flexibility to do as much as I can, and because of that, you want to give your best to this hospital and the workers, your co-workers, and they give that back to you.
And so to be able to have that type of a fluid transfer where your partners will see your patients in the ED, another group will follow them in the hospital, and you interact with these physicians on a regular basis. You know them personally as well as professionally. We've really already seen the benefits.
We've been able to kind of maintain doing the way that we want to do things and how we do them, and St. Vincent's has been very supportive of it. You know, I've been pleasantly surprised at the ability to communicate with the other physicians in our clinic system and hospitalists at the hospital.
You know, this is something that it speaks to me as a primary care provider. We've invested, you know, CHI St. Vincent has invested in developing an integrated medical group. We've moved on from just becoming almost an afterthought or department of the system to being our own independent organization. We believe in the physician enterprise, so much so that we are developing it as an independent unit. We've leveraged modern technology and an integrated group of primary care providers to the benefit of the patients.
St. Vincent is always striving to be the best in the community and nationwide, and I guess the world as well. And we have strived and achieved that in several specialties.
I like that it's faith-based. I like that everyone tries to do what's right for the patient at all times, and that cost isn't the driving force here.
Practicing for a Catholic healthcare organization that has a 126-year-old legacy and ministry here in Central Arkansas is really a wonderful way to connect with the community. Our patients come to us, our coworkers come to us, and they already have an image in their mind of the type of care they will receive. It's holistic, it's loving, it's nurturing, and I really believe that distinguishes us from other healthcare providers.
I think having a good team of physician liaisons like we have, I've been around to many of the family practice doc areas to meet them, and as a specialist I think it's important to reach out and go meet them, and we have the support to do that.
They help you develop and grow and achieve excellence, and I have been quite pleased and satisfied, and that's why I stay with St. Vincent. It's been my one and only job, and that speaks for itself.